Hey, welcome back to my channel. Today I'll talk about a very high yield topic for USMLE, and that is cognitive errors. These are highly tested during the examination time, so these are very high yield. So if you are preparing for USMLE or even for your self examinations, this video is very helpful for you. So without further ado, let's dive in. So let's talk about first cognitive bias, that is the anchoring bias. Okay, so what is anchoring bias? Anchoring bias actually means relying too heavily, okay, on the initial impressions, examination findings, or an early diagnosis and failing to okay, change the decision even when new evidence contradicts it. Okay, now I'll cite you an example. For example, if a patient presents with acute onset knee pain, okay, and the physician diagnose it as gout, okay, and even after like synovial fluid analysis which shows bacterial growth suggesting septic arthritis, physician keeps on thinking it as a gout and keeps on treating the patient as gout. So that is defending the initial diagnosis. Okay, so this is anchoring bias. Okay, and now remember this, anchoring means like anchor. Okay, that is anchoring means anchor equals to, okay, anchor means stop at the first diagnosis. Okay, whenever the physician is stopped at the first diagnosis, that is anchoring bias. Okay, now let's talk about availability bias. So availability bias is like very important one, and it's very easy to remember. Available means what comes easily to mind. Okay, so if we want to say it is what comes easy to remember. Okay, ways. Okay, so availability bias means like when a physician makes a diagnosis based on information that is most readily available in memory, okay, rather than the objective evaluation. For example, during flu season, okay, a physician repeatedly sees patients with cough and runny nose, okay, and diagnoses flu. Okay, when a patient with pneumonia suppose presents with similar symptoms during that flu season, physician still labels it as flu because why? Because flu cases are fresh in his memory, right? So that is availability bias. Okay, what comes easily to his mind, that is availability bias. Now let's talk about confirmation bias. Okay, confirmation bias means overly attached to a particular diagnosis, okay, and selectively focusing on evidence that supports it while ignoring information that contradicts it. Okay, I can understand that you might be confused with anchoring bias and confirmation bias. I will talk about them shortly. Okay, the differentiation thing. Let's first dive deep into this confirmation bias. Okay, so confirmation bias means overly attached to a particular diagnosis. Okay, in simple words, like the clinician tries to prove that the chosen diagnosis is correct. Okay, for example, I'll give you an example for this. Suppose a physician suspects pulmonary embolism, okay, and focus on the elevated D dimer, okay, but what he does is he ignores imaging, CT angiography, and even he ignores CT angiography as well as clinical findings that is suggesting pneumonia. Okay, easy way to remember confirmation bias is like confirmation bias means he wants to prove his diagnosis. Okay, prove his diagnosis, that is confirmation bias. Okay, important difference between anchoring bias and confirmation bias is the clinician actively searches for evidence to support the this like confirmation bias is that in anchoring bias the clinician is stuck to the first diagnosis. Okay, in anchoring bias the clinician is stuck to his first diagnosis. Okay, whereas in confirmation bias, what is that it, the clinician actively searches for evidence to support his chosen diagnosis and ignores the opposing data. Okay, so anchoring means stuck at his first diagnosis, whereas confirmation is proving. Confirm is seeking proof, right? So that is just easy way to remember, it's not the definition. Okay, Now let's talk about another important bias, and that is the framing bias. Okay, so framing bias is like, from the word we can easily say it's framed. Okay, framed, the decision is being influenced by by the prior levels or representation. Okay, it is being framed. Okay, simple, it's just framed. Okay, framed by someone else, easy way to remember it. Okay, suppose like this is when clinical decisions are influenced by the how information is presented or by another person's conclusion rather than his independent assessment. Okay, so rather than independent assessment, the decision is being influenced by how it is presented. Okay, suppose let's say a patient with a history of opioid abuse. Okay, presence in the urgent care. Okay, with acute abdominal pain, because the physician frames the patient as drug seeking, they may underestimate the severity of the symptoms. Okay, and overlook serious cases like appendicitis or perforation. Okay, and that delays the correct diagnosis and treatment. Okay, so that is framing bias. Okay, let's give another example, like suppose when a resident presents to a patient to an attending a patient to an attending, emphasizing that a likely diagnosis of UTI. Okay, now the attending is influenced by this framing and may overlook other important findings like blank pain and this fever spikes. Okay, missing pyelonephritis. Okay, so that is framing bias. Okay, framing means judgment is influenced by prior levels or presentation. Okay, that is framing bias. Now let's talk about visceral bias. Some of you might have heard about this, but this might be new to somebody. Okay, so what is visceral bias? It is actually when like positive or negative emotions towards a patient is influencing the decision making capacity. Okay, that can either lead to overdiagnosis or underdiagnosis. For example, physician feels irritated. Okay, suppose there is a frequent emergency department visitor and physician is being irritated by that patient. Okay, and he dismisses their symptoms, missing a serious underlying condition. Okay, that is visceral bias. So visceral bias is like, suppose, just to remember this, these are not definition. Okay, so these, suppose visceral bias, think about gut feelings. Okay, so it is actually when positive or negative emotions towards a patient influences the decision. Okay, and that results in the bias, that is the visceral bias. Okay, so let's summarize. We have talked about 5 important biases. Anchoring bias, think always like stock at the first diagnosis. Okay, availability bias is like, think about what comes easily available to mind, that is availability bias. Okay, confirmation bias means think about proving his diagnosis. Okay, to prove about the diagnosis. Framing bias is the diagnosis is being influenced by because of framing by someone else. Okay, visceral bias, think about gut feeling. I hope these cognitive errors are easy for you. I hope I'm able to clear the concept for you guys. If you think there are other important cognitive errors I need to talk about, please do comment and please subscribe my channel so that I can upload more high yield videos. So keep studying, keep learning, keep motivating yourself. Persistence is the key. So one step closer to match day. Stay blessed and thank you so much. Take care. Bye.